In this video, we are going to be looking at sleep deprivation and the health consequences. So, sleep deprivation is when you're sleeping 6 hours or less per night. We should be shooting for 7 to 8, maybe 9. A lot of us may believe that, oh, I'm good on 6. I don't need as much sleep. And a lot of people think that. And there is some evidence that there are some combinations of DNA that allow some people to get less sleep. However, these are extremely rare. From what I was reading, it seems like you're more likely to get struck by lightning than need only 6 hours or less per night. So these are very rare individuals, and a lot of us think that we're that way because we're only getting 6 hours of sleep per night already, and so we don't notice the impact of it. But if you started sleeping 8 hours a night, you might see the difference. So statistically speaking, all of us in here need somewhere between 7 and 9 hours of sleep a night. So let's look at the health consequences if we are only sleeping 6 or less. There was an interesting study that looked at military population and their sleep quality, and then looked at how they're faring in other elements of their life. On this chart right here, you don't want high bar graphs. So what this means is that you scored in the lowest quartile of, for instance, emotional health, social health, family health, and spiritual health. And as we can see, those with poor sleep did extremely poorly in all those aspects. So with sleep, it impacts across a wide range of things. If you can get your sleep right, you can fix a lot of problems in your life. And down here, obviously you see the good category is pretty good, moderate was a step up, and then poor was by far the worst. So let's take a look at cognitive function. They've measured some decreases in brain performance. They took a group, had them sleep only 6 hours a night for 14 days, and they were seeing how they would perform on different cognitive functions, and they found that every day their cognitive function decreased, and it didn't stop decreasing. So if you're only sleeping 6 hours a night, you kind of have to ask yourself, how could you be functioning if you were sleeping 8 hours a night? What would your performance be like? They've looked at reaction time with going 20 hours without sleep, and they found it is compared to legal drunkenness. So you are impaired to the same rate. Same with if you're only sleeping 6 hours a night, your reaction time is that of as if somebody had a blood alcohol content of 0.04, and then 4 hours, obviously, now you can't drive. So just be aware of that. Driving, again, is the statistically most dangerous activity you do for most of us. And so, sleeping 4 hours a night is on par with impairment as driving drunk. The reason for this is your brain needs REM sleep, and if it's not getting REM sleep, your brain's going to do micro sleeps. So what's happening is your brain is shutting off for microseconds, and you are actually unaware of this. You don't even know it's happening. And so this is why your reaction time can be delayed when you're driving, because your brain is shutting off and just going into like a brief REM cycle, trying to catch back up. With alcoholics, people who struggle with alcoholism, one of the issues is they're not getting very good REM sleep if they're drinking all the time. And so they can actually start hallucinating in real life when the brain is like forcing REM sleep on them. So obviously we need to get REM sleep. The brain needs it. So some other things real quick. Social loafing, decreases in charisma, decreases in efficiency have also been found. And there have been some studies investigating if doctors are only getting 4 hours of sleep. Potentially there are 20% medical mishaps due to lack of sleep, and then up to 5% of death perhaps has been caused by a lack of sleep. So for mental health, I found a little quote: short sleep equals short life. When you're awake, you're developing toxins in your brain, and when you go to sleep, especially your deep sleep, it's flushing all of those toxins out. So one of the things you build up while you're awake is beta amyloid, and they have seen that people with Alzheimer's disease have more beta amyloid in their brain. So we want to make sure we're sleeping so that we get rid of that, so we don't, increase our chances of getting Alzheimer's. Cortisol as well, it's a stress hormone, increases anxiety. That tends to go away when we go to sleep. Here's a good graph looking at that. They took a group and sleep deprived them, so they slept 6 hours or less, and then they had a group get a full night's rest. In the evening, they had the same amount of anxiety, and then in the morning, they obviously found that the sleep deprivation group had a lot more anxiety. So if you're struggling with that, we have depression risk goes up if you are not sleeping enough. Substance abuse goes up if you're not sleeping enough, and sleep deprivation matches a lot of the ADHD symptoms. So it can help your focus, it can help your test scores. It helps across the board in almost everything. Let's look at physical health real quick. We got blood pressure is lower if you're getting all your sleep. Chance of stroke increases, chance of diabetes increase, chance of heart attacks increase. Probably the craziest statistic I found looking at sleep is this effective daylight savings time. So in the spring, when everybody loses 1 hour of sleep because of the spring forward, heart attacks increase by 24% the day after. So just by people sleeping 1 hour less, heart attacks are, increasing by 24%. And then you'd think that's maybe just a statistical anomaly. It happens again in the fall. When everybody gains an hour of sleep during the time change, the risk of heart attack actually drops by 21% the day after. So, and that's repeatable every single year. So, it's really important for your heart to be getting enough sleep. Risk of obesity also increases by 25%. We have some hunger hormones. So leptin is our fullness, ghrelin is our hunger hormone. From sleep deprivation, they found decreases in leptin, so we feel less full, and they found increases in ghrelin, so we are hungrier. And in the real world, they've measured to see how this impacts actual eating. If you are only sleeping 6 hours a night, your hunger is driving you to eat about 200 to 300 extra calories per day. And over the long term, in a year, that's going to lead to 10 to 15 pounds of fat gain if we're not exercising, that extra calories off. And on top of that, if you did want to exercise enough to offset your lack of sleep, you'd have to run 525 miles in that year. So, you could sleep an extra 2 hours a night, or you could run 525 miles. When we're looking at diet and healthy choices, people who have eaten a good diet, as we can see right here, or who are sleeping, whose sleep is rated as good, 36% of those people are meeting the recommended dietary recommendations. And then in the poor category, only about 16 to 17% are meeting those guidelines. So you seem to make healthier choices when you are sleeping enough. We see testosterone also go down when you're not getting enough sleep. And if it's consistent, it seems like your testosterone is that of somebody who's 10 years older. So that's pretty significant. If you are trying to lose weight, again, we're going to talk about how to do that in a healthy way in this class because we need to be careful with it. It's not just weight loss. We need to talk about the ratio between fat mass and muscle mass. And one of the issues with not getting enough sleep is when you do attempt to lose weight, if you're only sleeping 6 hours a night, you're losing 70% of your weight from muscle. And we need as much muscle mass as possible in order to be healthy. And so, that's one of the first things that you need to get right is your sleep. If you can start getting your sleep right, you might even just start losing weight just from that fact. And it might be a healthy form of weight loss as well. So we need to be careful with that. This is looking at the amount of exercise in people who have good sleep versus poor sleep. As we can see, basically people who are getting good sleep have overall rates of aerobic exercise and of strength training. And if you're getting poor sleep, it really affects how much you exercise. Obviously, if you're tired, you're going to be less likely to exercise. And then last of all, if you have some sleep apnea, which makes it hard to sleep, we can get into a really bad cycle with obesity and sleep apnea and depression, because they all kind of reinforce each other. So you're depressed, which impedes your sleep. You can't sleep, which reinforces your depression. Your depression also tends to increase risk of obesity. So does a lack of sleep risks an increase in obesity. And then obesity negatively affects sleep and negatively affects depression. So you kind of get into this really nasty cycle. And so if we can start getting our sleep right, hopefully, if you are in that cycle, you can kind of pull your stuff out. And I think sleep is a really good place to start with that. If you're an athlete out there, this is just a study that looked at hours of sleep per night and chance of injury risk. There's a pretty significant drop-off if you're getting 8 hours or more, and 9 is even better. So for athletes, we kind of need as much sleep as we can get. Obviously, there is a point where there's too much. One of the reasons for this is when you're sleeping, you're releasing your HGH, human growth hormone, and testosterone, and you're recovering from the day before, and you're increasing your motor memory. So we'll talk more about that in another video. But the point is, people dope with testosterone and human growth hormone illegally, and it's unhealthy to do it as well. But if you go to sleep, you're actually producing it yourself. So yeah, it's kind of like if athletes aren't sleeping 8 to 9 hours a night, it's like they aren't doing everything they can to be the best athlete that they could be. All right, last one. Let's look at the immune function. So there was an interesting DNA analysis, again looking at 6 hours of sleep per night for 7 days in a row. And what they found was that 711 genes are poorly affected. So we see immune suppression, which means your immune system isn't functioning as well. We see tumor growth, so an increased risk in cancer, inflammation, and your immune system has to deal with inflammation. So inflammation is, typically not what we're looking for, at least general inflammation. And then cardiovascular disease tends to increase as well. And this is on the genetic level. If we look at cancer, sleep deprivation has been directly linked with bowel, prostate, and breast cancer. So if you're only sleeping 6 hours a night, you're increasing your risk of all of these. The World Health Organization has labeled shift work, which is like nighttime work, a probable carcinogen. And what that means is that it's probably a cancer-causing agent or situation in this case. So if you are like working nights or whatever, it takes about 6 days to adjust to a night schedule. And so you don't want to be switching your work schedule from days to nights every week. If you're going to work something, you want to get the same schedule so that you can adjust to that and so that your circadian rhythm can adjust. And then this picture that we have right here, this is a natural killer cell. Natural killer cells, they protect us against cancer and different viruses and bacteria, right? And 1 hour or 1 night of 4 hours of sleep actually decreases our natural killer cells by 70%. So, there are some real health effects across every level with sleep deprivation. Okay, I've gone on long enough. I'll see you in the next video.